267 San Diegans died from drug overdoses in 2011. Most of the deaths were linked to prescription painkillers like OxyContin. Now, hospital emergency departments are reevaluating their role in dispensing these medications. KPBS health reporter Kenny Goldberg says people looking for refills may soon have to go elsewhere.
Bobby Stevens, not his real name, first started popping OxyContin when he was in high school in North County. His classmates used to hand it out at parties. Stevens soon became hooked. At the height of his addiction, he was taking up to 20 OxyContin pills a day, plus the anti-anxiety drug Xanax and the amphetamine Adderall. He was spending $1,500 a week on his habit. Stevens used to get a lot of his drugs from hospital emergency rooms. He had a few standard lies he would tell the doctors.
That I either had lower back pain or I did something to my knee running. It pretty much was the same story every time. I would go to different doctors. I wouldn't go to the same ER. So I can pretty much use the same story.
Most of the time, ER doctors would give Stevens a prescription for at least a month's worth of pills. How much acting did it involve on your part to get the meds in the ER?
Not much, to be completely honest. I would just explain the pain that I had, but they were so busy, it seemed like, that they took you for your word and wrote you the prescription. So there wasn't a whole lot of, I didn't have to do x-rays, I didn't have to do an MRI or any of that type of stuff. They just asked what I was there for, and they wrote me the script.
Sales of prescription opiates have skyrocketed in recent years. So have drug-related deaths. And what's the major source of these drugs? It's not your local doctor, it's hospital emergency departments.
Well, I think all the emergency departments are experiencing an incredible influx of opiate requests and opiate-related emergencies. So when I say we're at the epicenter, we're just one of the emergency departments here in town that are seeing a deluge of these patients.
Alvarado Hospital sits right off a trolley stop in La Mesa. That makes it convenient for patients who need to see a doctor right away. Dr. Kelly points out physicians can't always tell when someone is in pain or just faking it.
Our goal, first of all, is we want to help. So each case we look at and we say, how can I help this person? And then second, we really want to do no harm, and that's where a lot of the narcotic issues come up. So there's a lot of harm that's related to the use and misuse of these medications.
Yeah. I'm not sure where though.
The emergency department at Scripps Mercy Hospital in Hillcrest is one of San Diego's busiest. More than 57,000 patients were treated here last year. Dr. Ranit Lev says lately she's noticed an enormous increase in patients who are asking for painkillers. These days, about 1 out of 5 patients in her ED are taking narcotics.
When you talk about, cocaine or heroin, you talk about the drug lords in Colombia, and you talk about designer drugs such as spice and bath salts, those are the chemists in China. But prescription drug abuse and deaths usually are given by well-intentioned, well-meaning physicians, and we need to kind of change the way we practice and get a hold of this epidemic.
To that end, Dr. Lev is leading an effort to change the way local emergency departments dispense painkillers. With the help of some other ED doctors in San Diego, Lev has come up with a set of guidelines. Under the new rules, people who come to the ED for chronic pain will be directed to visit their primary care doctor.
Someone who has pain for more than 3 months or needs any long-acting pain medications that last in the body for a long time, those are the people who need to get all their prescriptions coordinated by one prescriber and one pharmacy.
Dr. Lev says these changes will not affect people with acute or sudden pain from, say, a broken arm or a kidney stone. They'll be treated with the appropriate pain therapy. The new guidelines will affect people complaining of chronic pain.
That's the population at risk who die unintentionally. They don't know that they're taking all these medicines from different providers, different prescribers. They got something from the ER, something from the psychiatrist, something from the primary care doctor, and people die from that. And that's what we want to get a grasp on and prevent.
Dr. Michelle Lamantilla directs the chronic pain program at the San Isidro Health Center, a network of community clinics in the South Bay. She says there are some non-narcotic prescription drugs that are quite effective for chronic pain. LaMantia thinks doctors who prescribe narcotic painkillers need to be more careful.
I think sometimes we feel it's only 1% of people that might have a problem with the drugs and that we as physicians are going to easily be able to pick them up, but that's really not the case.
All hospitals in San Diego and Imperial County have tentatively agreed to the new narcotic guidelines. They could be rolled out sometime this spring. After 8 years of abusing narcotics, Bobby Stevens has finally quit. He's been in recovery now for 4 months. Stevens wishes those emergency room guidelines had been in place back when he got hooked on painkillers.
I don't personally feel like I would be where I'm at today if they weren't so easily available. So I think it's a great thing.
In 2010, more than 16,000 Americans died from an overdose of prescription narcotics. Kenny Goldberg, KPBS News.